All right, so we're starting to heat up finally. Here we go. Ooh, I'm starting to feel a little warm now. I'm still getting the raspberries down there and see what the system looks like. Lori, what are we up to?
Botox.
No. How hot did we get already?
We're now at about 39.
All right, where are we going? Target.
42.
42. All right, so we got a little time before we get much hotter. All right, so talk to me. What was Botox question?
Botox. When will I see those wrinkles disappear?
Botox. Okay, so Botox is one of the most commonly used injectables out there. It's probably one of the most famous names, and it's botulinum toxin. And there are lots of different compounds that are very similar to it. But bottom line is, Botox is it's not an immediate result. So the nice thing about fillers, when I do fillers in the office, to me they're so much more satisfying because you put them in, you know where you place them, you can see the results immediately, and yeah, you expect some swelling a little bit more the next day because it takes on some water, but it's not a big deal. Easy, quick recovery and all that stuff. But Botox is awesome. You can see I use some on my brow, but it does take some time for it to settle in. I've had patients who tell me, yeah, they start to see that it starts to settle in about 3 days or so, but usually it takes about a week for that to kick in. And what it does is it helps to reduce the amount of activity against around the muscle. So it basically relaxes those muscles, prevents you from the ability to activate the muscles. So there are two different things I look at when I do an exam. I'm going to look at the wrinkles that are based on the activation of the muscles, so like when you make a frown. And then there are some people who have wrinkles at rest, so even when they're not making a muscle or moving their face around. The wrinkles that you get at rest are really better addressed with filler. Although, in certain areas, like I find that in the glabella, like these areas, there's some people who have those lines at baseline, and it's great to put filler in there. So I actually find it to be very satisfying because there's some patients who they come in and say, doc, people just say I just look angry and I can't figure it out. And it's often in this area, like they'll have wrinkles in this area, wrinkles up in this area. So fillers are a great like immediate fix for that, but also for both the short-term and long-term fix. Botox is super helpful, particularly in those spots, because it helps to relax those muscles, prevent those wrinkles from getting deeper, and also prevent the active component of those wrinkles. Still no pain, still sitting here on Evolve, being productive.